Hey everybody, Dr. Rodman here, and today we're going to talk about tennis elbow, otherwise known as lateral epicondylitis, and one of the best tips that we give to our patients. So we see a lot of people that come in here and they're not always tennis players that present with this pain. A lot of times if it is from tennis, it's from a strong backhand and using these wrist extensor muscles, but a lot of times it can happen from heavy gripping. Somebody who's just doing maybe a lot of yard work, or somebody in the gym who's doing a lot of gripping, dumbbells, things like that, or sometimes we see it for no reason. And if you're one of those people, it could be this tip that we explained to you today that really helps you out. And I like to give you a little anatomy first, and they call it lateral epicondylitis because a lot of these muscles start from the lateral epicondyle on the humerus. And what happens is you see how some of them cross the joint into the hand and actually become extensors of the hand or fingers. And that's the reason why a lot of people have problems. And what we do is we tell them, like for instance, on Bones here, who is coming to you with his new Halloween outfit, those muscles start here, they cross the joint, and when you do this, they're being shortened. But a lot of people actually sleep in a position with their hand like this. So what happens is these muscles are now getting really stretched all night. So what we do is we tell patients that if they're not responding very well to our treatment, it's probably because they're sleeping like this. So what we do is we have our chiropractic intern here, Dr. Ricky, and he's showing you what we do is we give people these wrist splints. And this is something very good to have at home if you are a tennis player and want to prevent lateral epicondylitis too, or if you're currently having this pain, because as you can see there's a splint in here that won't allow his hand to bend. So it keeps him in that neutral position all night, so he can't sleep like this or like this. It's going to stay straight. And then sometimes what happens is that elbow pain will be coming from a muscle that actually crosses the elbow joint here, like the brachialis or brachioradialis muscles. And what happens is when you sleep with that arm bent all night like this, you're actually shortening it and it becomes really stiff and tight in the morning. So we tell those patients that we want to actually get sometimes an elbow splint, which just keeps their arm straight. And yes, it is a little bit uncomfortable at first to wear these, but after about 2 or 3 days, it gets pretty normal. So these are great if you're picking up a lot of activity, if you've had elbow issues in the past, want to prevent them to sleep with something like this. So I hope that helps you out. If you have any lateral epicondylitis or any elbow issues, we'd be glad to help you in the office. We have a lot of therapies that can get rid of it quick, and then we can educate you on what you can do on your own to help yourself.